Star Montgomery College has an awesome clinical simulation lab. You feel like you're in a hospital. Like you'll go in and you're doing an assessment on somebody, and all of a sudden you take a blood pressure and it can change, or you're asking a person questions and they're telling, and the dummy's talking back to you, and it's like this real life. A good way to learn is from other people's mistakes and your own, and you can make them in this place. It's okay to make a mistake because you're learning from it, and okay, I will never do that again. And you don't have to do it on a real life person. You can make the mistake here and learn from it. During the progression of the program, I decided, I do like this stuff. This is cool. This is interesting to me. And then once I started working, I was like, this is what I wanted to do. This is what I want. I just didn't know what it was, because I wanted to be with patients. I wanted to do stuff. I wanted to be an important person in someone's care. One thing about Lone Star Montgomery College, they drilled into you critical thinking, looking more into what's going on in this situation, not just seeing this person's bleeding, let's patch him up. This program taught me to not just see that and try to take care of that, but see why. Saving a patient's life is the best part of the day. But using the skills to save this person, becoming a team together is a very rewarding thing. You have to know what you're doing. I mean, I think anyone can start something on you like an IV, but to know where the placement should be, what size of needle you should use for this IV, what type of medications can go in this IV, what type of medications can, and how fast you should do it. All that comes from learning at a program like this, where you learn an RN role. You don't want to spend all your time going to school for something that you really don't know what you're getting into. You can spend your 4 years of school and then realize that I don't like to work in this. As a nurse, you're actually dealing with nasty things. You're dealing with very hazardous things. So I would tell someone to do their research and start off small. Do some volunteering, get a nurse's aide, become an LVN, and then you can decide on, okay, I do like this stuff, it's time for me to move on and keep progressing yourself to where you want to get to. I recommend Lone Star Montgomery College's ADN program to anyone. I think I've got a very good base to where I will expand and become a better nurse than what they've made me.